Hi, I'm Vikas Desai. I'm the Vice President of BestRX's pharmacy software. I'm the main account manager. I handle marketing as well as accounting duties. BestRX prides itself on its user-friendliness of the system. That user-friendliness allows a pharmacist to have more time with their patients. On top of that, we provide great value with the software. We have very feature-rich software. We have excellent customer service. One of the things I hear from our customers is, you guys have the best customer service in the industry, and that's something we really pride ourselves on. Well, BestRX prides itself on having a great support staff. We train our staff in-house to make sure we have proper supervision over all of them, make sure they can handle any calls quickly and efficiently, and if they can't handle it, they can always come and ask the higher level management to come in and step in and help them out. We use a great software by TeamViewer as well, which makes it easy for us to connect to our customers' computers, help them out with whatever they need help with, and then we can quickly disconnect and have them get on their way. We also like to keep in touch with our longtime customers, make sure they are getting what they need. We take their response, their feedback, and try to implement their ideas into the software. And most of the time when people call in, it's going to be an immediate assistance. They're not going to have to leave a voicemail and wait for a call back. A lot of times I hear customers complaining how other software vendors have to leave a voicemail, and even then they have to wait sometimes hours for a call back. We pride ourselves in responding quickly and efficiently to help resolve a pharmacy's issues. At BestRX, we want to deliver elegant, easy-to-use pharmacy software that helps pharmacies grow their profits, enhance efficiency, and allow the pharmacists to dedicate more time to patients. Recently, we've shifted our model from a more pill-centric model to a patient-centric model. So before, the industry was just like, get the patient in and out, make sure you can fill our scripts, hand it to the patient, and move on to the next prescription. Instead of patients just coming to the pharmacy, pick up their prescriptions or their refills, we want patients to come in, be able to ask questions to the pharmacist, and we want to make sure the pharmacists have time to answer any questions the patients may have, as well as have any kind of medication guidance on any new prescriptions they may be filling at the time. Well, the user-friendliness of BestRX makes it easy to perform everyday tasks for our pharmacists. That way they have more time for their patients to provide one-on-one guidance if needed. Also, we integrated with a lot of industry partners. This allows for a lot more functionality within the software and a lot more money-making opportunities for the pharmacies so they can continue to do what they do best, which is serve their customers. And lastly, we listen to feedback from our customers on a daily basis. We get about 100 to 200 requests in a month. We use this feedback to make updates within the BestRX software to enhance efficiency, user-friendliness, and just make it a more robust system for our pharmacists.
Hi, my name is Hemal Desai, and I'm President of BestRX Pharmacy Software. I oversee all aspects of the company, from things such as development, marketing, and operations, as well as client relations. For community pharmacies, maintaining their star ratings is important for a variety of reasons. First and foremost, star ratings are a measure of how healthy a pharmacy is keeping their patients. And for independent pharmacies, keeping their patients healthy is their primary goal. Along with keeping their patients healthy, there are also financial incentives to maintaining your star ratings. Higher star ratings lead to higher reimbursement rates as well as lower DIR fees, which all affect a pharmacy's bottom line. One of the main ways to maintain your star ratings is to improve patient adherence, and BestRX offers many tools that help out with that. We have things such as refill reminder reports, auto refill functionality to help automate the refilling process. On the patient end, we can send text and email reminders to a patient so that they can easily request a refill without having to call a pharmacy. Building on top of that, we can also integrate with the pharmacy's website and mobile app, which gives a patient another avenue of requesting their refills. We're also proud to be one of the first companies partnering with ScriptDrop to offer a brand new service which sends text reminders for every single dose of a medication that a patient needs to take. I personally have been using this service for the past month, and I haven't missed a dose of my medication since using that service. Along with adherence, medication therapy management is also important for star ratings. We integrate with many partners that will present MTM opportunities to a pharmacy so they can act on them to not only help out their patients, but then also get reimbursed for their efforts. We also integrate with other partners such as Prescribe Wellness and FDS that help to supplement a pharmacy's star ratings. Companies like those offer advanced reports and analytics that build upon the services that BestRX offers within our software. Today, the role of a pharmacy has changed quite a bit from even a decade ago. In the past, a pharmacy was more on the pill-centric model where they would dispense prescriptions and get them out to patients. It's more of a patient-centric model, and a pharmacy is performing more roles that in the past used to be relegated to the doctor's office. These include things such as immunizations, A1C testing, pregnancy testing, among other things. As a pharmacy performs these functions, there's a need to communicate the results of these tests and other things back to the prescribers, as well as the health plans. So we're excited to be working with a couple of initiatives that help out with this. One of the ones that we're most excited about is working with CCNC, which is the Community Care of North Carolina, to help connect pharmacies, prescribers, and plans in a way that has never been done before. They're piloting a service in their state that allows all of these entities to communicate together, which so far has resulted in increased patient care and has saved the state millions of dollars in healthcare costs. We're also happy to be partnering with UpDocs and their Pharmacy Connect service, which will allow our pharmacies to leverage UpDocs' large network of prescribers so that they can coordinate patient care with a patient's doctor. For independent and community pharmacies, they're often so busy with the prescription end of their business that it's easy for them to neglect the front end of their pharmacy. There are many benefits that having a point-of-sale system that is integrated with your pharmacy system has for pharmacies. The most obvious is that it completes a workflow by recording when prescriptions are dispensed as well as returned. This helps out with auditing and prescription tracking purposes. Another huge time-saving feature for having a point-of-sale system is that it automates pricing and inventory. By integrating with a pharmacy's wholesaler, a pharmacy that has a large front-end inventory can save invaluable amounts of time. Another thing that a point-of-sale system does is it simplifies signature capturing. They can electronically store signatures for things such as prescriptions, HIPAA, credit card signatures, and even controlled substance purchases such as PSE items. This means that when it's time for an audit, the pharmacy does not have to spend time digging back in their paper records looking for these signatures. A point-of-sale system also has many reports that can help you track sales trends, provide analytics, and do other things that help you manage your profits. The benefits of having a point-of-sale system can even extend out to your patients. Our system has a built-in loyalty program that can help you reward your repeat customers by providing them savings the more often they come to your pharmacy. As with all sectors of the software industry, pharmacy software is no different and is always evolving. We realize that it's important to be nimble and agile when developing a roadmap. While we have a plan in place for the next 6 months, 12 months, and so on, that plan is not set in stone. It's important to be very fluid. New requirements will pop up, new projects will present themselves, and when they do, we do our best to fit them in depending on how important they are. We also realize that no company can do everything on their own, and that it's very important to work with and integrate with other companies within the industry. Whenever a new company comes to us and asks for a new integration or a new partnership, we listen to them with open ears and see whether it's going to be beneficial to our clients and their patients. Many companies have even told us how much they love to work with us because of how quickly we're able to adapt and integrate with their services. At the end of the day, our goal is to give a pharmacy the tools necessary so that they can accomplish their goals, which is to better serve their patients and their community.
Hi, my name is Bart Rogacewicz and I'm the Senior Operations Manager at BestRX's Pharmacy Software. Aside from taking care of and overseeing our support staff, I'm also involved in a lot of other aspects of our business, including graphic design, marketing, taking care of our software and hardware needs inside of our office. We're seeing healthcare transition to a value-based care system. There's an incredible need for solutions to really move and push the pharmacies forward. Collaboration on all fronts is going to be incredibly integral in inventing and delivering solutions that support pharmacists to provide expanded care services in their communities. At BestRx, we attempt to collaborate with the entire industry to do exactly that. We're trying to help pharmacies stay at the leading edge of technology by providing affordable, innovative, and turnkey solutions. Well, community pharmacies are really playing a significant role to fill this gap. 70% of costs are going to treat preventable diseases, while we really have a need for preventable services. This shift in burden is going to end up equaling higher deductibles, higher copays, where we're going to see regular checkups really become a luxury. Approximately $300 billion are spent due to lack of adherence. This cost is due to Americans not taking their prescriptions regularly or even correctly. They end up going to the ER, they end up escalating the problem where it could have really been avoided to begin with. The average physician nowadays is spending less than 5 minutes of their time to explain this, and that's where the pharmacy is beginning to step in. We're really seeing community pharmacies utilize technology to understand the population better, take a proactive approach to these problems, consult their patients, raise their start ratings, and even implement an appointment-based business model to try to reduce the patient burden. Well, the appointment-based model really truly allows the pharmacists to be able to perform one-on-one consultations with their patients. As we know, patient education is incredibly beneficial for the entire ecosystem. By expanding these services and introducing things like medication synchronization, patient loyalty programs, medication therapy management, and others, they're further enhancing patient care on a day-to-day basis. We'll see higher adherence due to this. We'll see higher pharmacy revenue, which will in turn allow the pharmacies to provide more of these services. This is all hugely beneficial in the long run for the patient and everybody involved, including these pharmacists. Pharmacists are becoming more and more involved in providing services to their patients. Things like immunizations, patient-centric care, consultations, and collaborations. These are all roles that traditional pharmacists were able to avoid, but they're now becoming standard in the field. A patient sees their pharmacist a lot more than their physician. When they're having an adverse reaction to a medication, it is oftentimes a lot easier for them to speak to their pharmacist rather than to reach out to their doctor, who might oftentimes be unavailable. This places more and more responsibility on the pharmacist to educate the patient, and it really is the key to enhancing patient care in the long run. For example, when a patient is having an adverse reaction to the medication, it is oftentimes a lot easier for them to see their pharmacist rather than a doctor, who might oftentimes even be unavailable. The pharmacist can then reach out to the prescriber to attempt to adjust the regimen to avoid these reactions.